Hello, listeners. Thank you for joining me on 21st Century Native Leaders. My name is Peter Deswood III. I hope you enjoy this podcast episode. Please comment and share this so other people can hear the experiences of my guest today. Thank you and enjoy. Hello, listeners. Thank you for joining me on 21st Century Native Leaders. My name is Peter Deswood III, and I am here with Kelvin Dan. Kelvin is a medical doctor. On his business card it says MD, and he is in his residency currently. Thanks for joining us, Dr. Dan.
Oh, yeah, thanks. I'm a big fan of your podcast.
Thanks a lot for listening. So, talk with me. Tell me a little bit about yourself, your tribal affiliation, where you come from, your clans.
Yeah, my name is Kelvin Dan. Tuohana Nishla, Shkamzo Bashichin, Azlanasche Aro Porkonje Shinala. I'm originally from Chochimito, Arizona. Right now I'm in Phoenix, Arizona. I'm doing my residency in internal medicine. Just started my third year last week. So currently a third year. I'm on my day off. I'm on my ICU rotation right now, so it's pretty busy.
Wow, that's awesome. So, talk with me a little bit about when you decided to pursue a medical career.
I guess I got interested in when I'd say I had some interest when I was in high school, just like taking like my biology classes and chemistry classes, and then I took a Navajo, kind of like a Navajo history class. And one of the projects was just to kind of talk about issues among Native Americans or Navajos. And I think one of the issues I talked about was just like diabetes and like, alcoholism and kind of how that affects your health and just kind of like the tribe. And then I kind of that's when I kind of got interested in that and just kind of learn more about diabetes. And then I went to the University of Arizona for college. I majored in molecular and cell biology and took a class called like cancer, Native Americans and like cancer. So it kind of focused more on like public health. One of the things we talked about a lot was the uranium mines, and so really just kind of learning about how cancer develops from like the cell, the level of the cell and DNA, and then kind of how the uranium mines caused or led to exposure to uranium and lung cancer and lung disease. And then we also talked about diabetes and how it's like a big issue and how it affects the body, how it affects, the heart, the kidneys. So just kind of learning about that even more in college. And then that's kind of when I decided I wanted to go into the medical field. The only issue was that I'm a first generation like college student, and so my parents didn't go to college, or they have some college, but they didn't graduate, and so I didn't really have a lot of people to go to get advice. So after I got out of college, I kind of worked some odd jobs, but I worked at a IHS clinic just as a lab assistant, like running lab tests, and just like learning all the different like labs and why the doctors like order them, and kind of use that experience to apply to medical school. And then I graduated in 2017 from University of North Dakota. So, and then now I'm on my third year of residency in internal medicine.
Wow, that's cool. So does University of North Dakota have like a native medical partnership? Because I know of a couple other people that went through that program that.
Yeah, yeah, they have the InMed program, the Indians in Medicine program.
Oh, okay.
Yeah, that's like a big reason why I went. I knew some people that attended UND and told me about the program. So it's like it's like a so yeah, they support all Native American students and like medical profession, who are going into medical professions like public health and nursing school, medical school. So they have a lot of resources. They have they have like an office or not an office, like a center where you can go and study and check out books. And yeah, I would go. I was pretty much there every day, and they helped me out a lot, like financially too. Like they provided like some financial support for Native American students. They have like a pretty well-known history of graduating Native American physicians. Um, so so like the InMed program, so the way it works is like the University of North Dakota, their class size is about, I think, like 70 or 80.
Mm-hmm.
And five of the, I think there's like six of those spots are who plan on attending or who plan to practice on the reservation. So when you're interviewing, you got to demonstrate a strong desire to go back to the reservation. I think University of Arizona has an InMed program, but I think it's through like a grant, and I think they have to like renew the grant. So I'm not sure what the status is on that.
Nice. That's pretty cool. So do you know what area you're going to focus on? Is it going to be diabetes, community health, or?
Yeah, so like internal medicine has like a bunch of specialties. I think there's like at least like 10 of them, but I think just like from my experience in residency, I feel like primary care and outpatient medicine is what I want to work on, or that's what I want to like go into. With primary care, it's mostly you work in the clinic, and then the way they train us in internal medicine, they train us to do hospital medicine, which means you treat or you see patients in the hospital. I mean I don't mind doing it, but I'd rather work in the clinic, just because it can get kind of stressful in the hospital, especially in the ICU.
Mm-hmm. So talk with me a little bit about your research on the uranium. I did interview Dr. Tommy Rock, and he does quite extensive research in uranium, and I remember him talking and saying that there's like over 550 abandoned uranium mines on the Navajo reservation, and he talked about there being trace amounts of uranium in Navajo people because of it being in the water and the groundwater. So talk to me a little bit about your research and what did you find out whenever you looked at uranium?
I mean, it's been a while. Like I graduated like in 2009 from my undergrad, so I'd have to kind of look up like some of the stuff I worked on. But I worked in a research lab with Dr. Monica Yellowhair. I think she's an assistant professor at the U of A now. She's Navajo as well. I think she'd probably be the best person to talk about with that.
Okay.
But I think from what I learned from my project in the lab is that my projects were more like with like cell models, and so like we would treat different cell cultures with like different. We would treat it with like uranium, arsenic, and kind of like different natural chemicals and radioactive material, and just kind of see how it affects the DNA and the gene expression of those DNA. From the project I did, like we just kind of saw that there's like increased oxidative damage to the DNA.
Mm-hmm.
So you're having damage at the level of the DNA from like uranium. But I think Dr. Yellowhair would probably be like the expert on that.
Oh, nice.
I would recommend her for if you ever had a future like guest you had in mind.
That's awesome. That's so cool. So, talk with me about the process. I know it's pretty extensive to becoming a medical doctor or going through med school. So, like, how many years do you have a master's degree? I know you talked a little about your undergrad. I know some people that go through the medical program end up getting a master's in health or something like that. But talk with me a little bit about that process.
Yeah, it was hard for me just because I don't have any family members who are doctors or. Well, actually, I take that back. I have a relative on my dad's side who's a doctor, but I didn't know that until just recently. But like while I was an undergrad, I didn't have a lot of like mentors. So yeah, you got to get your bachelor's. So most people will, if they want to apply to medical school, they will, go talk to the pre-med advisor, and the pre-med advisor will, recommend courses. So what you're doing is so when you're an undergrad, you're studying for the MCAT. So the MCAT is like the aptitude test to apply to medical school. So you gotta take college courses in order to study for the MCAT. So the MCAT, they test you on organic chemistry, biology, physics, and I think like your verbal reasoning. Actually, I think they added a new section not too long ago. They added like a psychology section. While you're obtaining your bachelor's degree, you have to take the MCAT test, and medical schools. Some medical schools have a certain score you got to get on the MCAT. Like they won't even look at your application unless you score high enough. So once you get your bachelor's, and then you take the MCAT, and then you can apply to medical school. But in my case, I graduated, and I was just working just lab jobs for 2 years, and then I did a master's program in physiology at the University of Arizona, and it was more to just take more classes in physiology and to just give myself more time to volunteer and get my application ready for medical school. So a master's isn't required. Like there's a lot of I guess like the traditional medical student will do 4 years, take the MCAT, and then get into medical school. But I think for Native Americans, it's not so easy, just because. Well, I think for one, a lot of my co-residents, their parents are doctors, and their grandparents and brothers and sisters, like they come from a family of doctors, so they know the timeline. I feel like they're the traditional like medical. They're the traditional medical student that went 4 years and went straight to medical school. Whereas I think for myself and a lot of other Native Americans, there's usually like we would finish our bachelor's or undergrad, and then take a couple of years to actually apply to medical school. And then once you get into medical school, it's 4 years. Your first 2 years are your didactics, where you sit in the class and you take you take your tests. It's more like book learning. And then the third and fourth year is your clinical years, where you rotate in the hospital. And so during those 4 years of medical school, you have to take 2 board exams. So there's this USMLE Step 1 board exam you take as a second year. And then the USMLE Step 2 you take at the end of your third year. When you become a fourth year, that's when you apply to residency. And then the whole residency process is it's really stressful. It's like applying to med school all over again. And then once you match into a residency program, and then that's when you like get into residency. So that's usually 3 years, a 3 year program where you're kind of doing on the job training. You're learning, and you're kind of like you're practicing under the attending. So your attending is kind of like teaching you, just how to be a doctor, either in the hospital or in the clinic. So I say in total, so 4 years of undergrad, 4 years of medical school, and then 3 years of residency. So that's at least like 11 years of, just school and training. But surgery, it's longer. I think surgery is 5 years. Their residency is 5 years.
Wow, that's amazing. So you talked a little bit about the residency. So is it competitive to become a resident?
Yeah, it's tough. I was actually surprised that I matched where I wanted to go because, my step one score, I passed, but I wasn't really happy with my final score. So I mentioned those board exams you got to take as a medical student. So when you apply to residency, all the programs will look at your board exams, and a lot of them will have a cutoff. They won't look at your application unless you scored a certain. If you have a certain score, they'll look at your application. But if you don't, they won't even look at your application. And if you fail one of those exams, I think a lot of them will. Well, on their websites, their requirement will be must pass board exam on first attempt. If you don't pass on your first attempt, your options are going to be really limited. Yeah, I think the internal medicine is pretty competitive just because there's a lot of subspecialties of internal medicine, like, cardiology, gastroenterology, and like critical care, ICU. Those are all like subspecialties. So you have to go through internal medicine to get to the specialty.
So is it additional schooling if you specialize?
Yeah. It's called fellowship. So once you finish residency, if you decide to specialize, you go into a fellowship program, and so it's usually like another 3 years. I know like cardiology, GI, like critical care, ICU. Those are all 3 years. So yeah, but it's nice though. Just I think in some ways, just because when you become a specialist, you only focus on one area.
Mm-hmm.
So like if you're a kidney doctor, that's all you have to worry about. Like if you don't manage like someone's like if someone has like a heart condition, then you probably wouldn't be managing that so much. So primary care is you kind of have to cover everything.
Mm-hmm.
And I want to go back and practice on the reservation. And so most Indian health medical centers don't have specialists, or they don't employ specialists. They only employ primary care. So like primary care is like family medicine, internal medicine, general surgery, pediatrics. Or if you're to specialize, if you're to become a specialist, then I think you're going to be probably working like in a bigger, like either a city or a place like Flagstaff or Farmington, just because those are bigger hospitals with who hire specialists.
That's really interesting.
Yeah. I like primary care. I really like diabetes. That's usually my favorite thing when I'm in doing clinic, and when someone comes in for a diabetes checkup. Those are usually like my favorite, because I think just like having family members with diabetes, I understand like kind of where they're coming from. And
That's awesome. So talk with me a little bit about the challenges you face, maybe being Navajo in a traditionally, I guess, white dominated field.
oh yeah, it's like an everyday struggle sometimes. I think for one thing is like communication. Most especially Navajos, like we're not very open. Well, I mean, I'm kind of speaking for myself, but like I'm not really like a talkative person, and I feel like the when we're evaluated by our attending, like a lot of it comes down to your communication skills. And if you're not a talkative person, or if you're not the first to speak up, and a lot of times they just assume that either you don't know or you don't care. And so I kind of have to make myself like speak up, or just small talk, just so that the attending knows I'm present in the conversation, or that I'm present on the case that we're discussing. And then a lot of times too, I'm in Phoenix at the Banner University Medical Center. We get a lot of transfers from like Chinle and Tuba City, and so a lot of the other doctors, they've never worked with Native American people, and so there's a lot of assumptions about their history and kind of like their background. And a lot of times I have to kind of speak up for patients, and kind of let my team know that not all Native Americans are come from a poor background, or from I just have to kind of speak up for myself and for Native American people. Yeah, I'd say those are kind of the big stuff that I can think about. And then as a medical student, I think the biggest assumption is that Native Americans go to school for free, and that we're there because we're minority, and that we didn't have to work as hard as the other Bologana or white students. I think that's an assumption. Yeah, it's something that you gotta have to. I kind of run into almost maybe not a daily thing, but it's something that comes up at least every week, once a week.
That's awesome. So I know you mentioned this a little bit earlier, but is there a lot of support for Native students? I know you talked about at North Dakota, but talk to me a little bit more about the support. Just, I mean, I'm asking some of these questions just for example, I know a little bit about it. I know a lot, but just in case some younger students, high school, undergrad students might be listening, as far as support, what they might look for, and what type of support is out there if you're going through medical school and if you're in your residence.
I think there's definitely support, but I think the issue is there's just not a lot of mentors, people to reach out and help. I think most of the time, the people that would help me out the most were when I was an undergrad. I would reach out to the medical students because they're closer, to me as far as their training. When I was when you're a college student and you're talking to a medical student, they're only maybe 2 years apart as far as where they're at in their education. Mm-hmm. I feel that's where I got the most help and the most support. Was I would have to reach out and talk to people who are going through it. And then when I became a medical student, I would reach out to the medical students who were a year ahead of me or 2 years ahead of me. I feel that's where I got the most support, was from your peers. Because there's support. There's always going to be support for as far as a multicultural office or a multicultural center. I think that it's mandatory for every medical school to have a multicultural office, or a multicultural office for support. I think it's mandatory. It's a accreditation. It's mandatory for their accreditation. So if you go to U of A, they have this office for multicultural students. So there is support. I think it's just you got to find the people to help you out. A lot of times, the people that work in those offices, they haven't been through medical school, or they haven't been through it. I think the most support comes from talking to the people who've actually been through it, because they'll kind of give you little tips here and there. Yeah, I'd say if I were to give advice to a high school or a college student, it would be to find someone who's in medical school right now, and talk to them, because I can't really. For me, it's 10 years since I was an undergrad, and they changed the MCAT, so I can't really give them advice on how to study for the MCAT. But I can definitely talk to the resident, like the other residents and the medical students, because I'm only a couple years ahead of them.
Mm-hmm. That's cool. So, whenever traditionally, Navajo people, they kind of stay away from talking about death, or whenever there's death in community.
Yeah.
How do you balance your traditional beliefs with dealing with death in a hospital? So how like our grandparents would say, "Oh, you're not supposed to bother that. You're not supposed to deal with death." But how do you have an aunt that had wanted to do medical school, but she couldn't get over handling other people's blood because of our traditional beliefs, right? So she ended up getting a master's in public health, but then she ended up becoming a science teacher. Mm-hmm. So how do you balance that, your traditional Navajo beliefs with your career that you decide to choose?
Yeah. Oh yeah, that's a really good example. Ever since I was an undergrad, it's something I had to deal with. Working in the lab, samples or might come from a patient, a tumor cell that was biopsied from someone. So it's something I kind of ran into more than 10 years ago. So a lot of it would come down to me just talking to my parents, because they're very my mom especially, she's very traditional and has a better understanding of Navajo tradition. So I would talk to her first, and then we would talk to either medicine men, and we would kind of have a discussion with them, and just to let them know that what I'm doing, and then get some we would get a blessing from them, so that I can go. It's more, I think it's more just a mental. For me, it's more like a mental thing where I got to kind of if I didn't do that, if I didn't talk to my family and talk to medicine men, then I'd probably have a lot more anxiety, and I would be very nervous approaching someone dying in the ICU. But it's something, getting those blessings. I try to do that at least a couple times a year. Mm-hmm. Maybe whenever I have an extended break. So I'd say at least 3 or 4 times a year I'll get get a blessing from the Navajo medicine men, just so that it'll help me, just kind of give me a smoother, just to it'll just kind of help me get through it, mentally. Yeah, I'm in the ICU right now. It's pretty intense. It's I think on my team, I think we've probably had about 4 people die this week. So it's pretty intense. And then it's funny that you mentioned that. Yeah, I agree with what you said about Navajos not talking about death, because we see a lot of Navajos here in the hospital, and one of the questions we have to ask all patients that come in the hospital is what your code status is. So you can either be full code or DNR. So the way we approach that is we ask if someone's heart were to stop, would you want us to do chest compressions? And then a lot of times we run into a roadblock with Navajo patients, or Navajo families, because they don't even want to entertain, or they don't even want to acknowledge that question. They're like we're not talking about that. We're not talking about death. Let's just not talk about that. So then we kind of all have to look at each other, and we're like, well, what do we do? And so a lot of times we just have to assume that, they're full code. They're full code unless they say no.
So full code means then you go through and you resuscitate and keep them on life support.
Yeah, full code means you do chest compressions and you intubate them. So you would put a tube into their airway, and they would be hooked up to a ventilator. Mm-hmm. That means full code usually means do everything possible to keep someone alive. Sometimes can be good, but sometimes it's usually not a good idea, especially if someone's like 80 or 90.
Mm-hmm.
Like they won't survive chest compressions. Probably like they'll probably like they probably wouldn't survive, and it's just gonna cause more pain and suffering to someone. So we try to have like one of my goals on ICU is to talk to families and have that discussion with them, and try to be more. I'm trying to get better at talking about end of life and comfort care with families.
Mm-hmm.
I think just being Navajo, we don't talk about that, but I think it's something I really want to kind of get better at, and maybe even when I go back to the reservation, that's something I want to, have a discussion with everyone.
That's so true. It's interesting, and it's such a like it feels sometimes there's a block there because like we're living in modern times, but yet we have traditional beliefs and values where there's a I guess they call it intersectionality, right, of who we are as people. And for example, my dad passed away a few years ago, right? Like luckily he got insurance and was covered, but I have relatives who didn't talk about that, and they didn't do a lot of planning.
Yeah.
And then now my aunt or my uncle is left with a bag full of debt.
Yeah.
Or where they didn't cover themselves financially, and because of that not being able to talk about death or planning, and you look at that in Bulaganas or people that are non-Navajo, they do planning. They take out plots for their burial grounds, or there's I can't remember the other term, but there's insurance you can get to help cover your whenever your funeral expenses. And so then like you look at that and in some points it ends up in the long run it ends up hurting us as Navajo people. And I'm only speaking about Navajo because I know in Navajo culture we can't really talk about death and it's taboo, but I'm not too sure if other tribes are like that, so I'm being very specific about Navajo people.
Yeah.
So like, on your part, then you're doing a lot of educating and talking with people. And I think that's the important component, is that you have that cultural and that understanding of both being Navajo and living in both worlds. And I think that's pretty important. So what percent of your job do you think is educating your patients?
It should be 100%. Honestly, like educating them on their living a healthy lifestyle, and especially with new medications, you got to educate them. Especially when if it's a new diagnosis, you got to educate them on what are complications and what are things you got to look out for. Like if something were to get worse, you need to come back, or you need to call, or. Yeah, I think I'd say like every encounter every patient encounter should be there should be some education. Sometimes it gets really busy some days, but I definitely try to make time. If a family wants to speak to the team, I like to volunteer and talk to them. And so yeah, I think that's a big part of the job.
That's awesome. So I know I hear this quite often. How with not social media, but with access to internet and WebMD, do you have that discussion or the debate with your patients that say, well, I looked it up in WebMD and this is what it says, and then, I don't know, self-diagnosing? I think I read an article once saying that self-diagnosis has increased with access to internet. I mean, do you get into that conflict with your patients?
Yeah, it's more. Yeah, I'd say I run into it a lot in the clinic, especially with like vitamins and supplements. Someone will look something up and find like some supplement that's going to help them with their heart disease. Like I'll talk with them about it. There's usually no harm in it, but I'll just I'll tell them like we don't have a lot of information about this supplement. Just kind of acknowledge like as long as they're telling us, and as long as it's not interacting with any of their medications or their like conditions that they're diagnosed with, I think it's usually okay. But a lot of times, yeah, we usually just acknowledge, like, okay, yeah, it's interesting you looked that up, but this is all, you gotta like, just try to acknowledge what they read, and then just kind of teach them, what our understanding is of, what's going on.
Mm-hmm.
So yeah, that run into that a lot.
Well, we've had a really good discussion, and I'm really fascinated with the work you're doing, and appreciate that you're out there and breaking barriers. Is there anything else you would like to add?
I think medical school and residency, it's just a long process. It's really, it's really stressful. I mean, it's kind of like, it's stressful, but then it's rewarding at the same time. I think you really got to put in a lot of work for yourself and just do it. Like if I were to give it more advice, I would say just, do it for yourself. Don't do it for anyone else. When I was an undergrad, I met so many like other students my age who had the same desire to go to medical school, and then they realized how much work and how much sacrifice was involved, and they either lost interest or which left school altogether. Yeah, I would say like find mentors who are maybe a couple of years ahead of you, and they'll really help you. And definitely surround yourself with good people who who want to help you with your with your journey and with your goals. I'd say that, and yeah, just keep reading. I think reading is a big part of this job too. Like it's like we learn things every day. We have to look up and read like every day. There's always something new to learn, like and with every patient. So I would say like just develop a habit of reading, whether it's just like a book or the news. I think I picked that up from my dad. My dad, he reads books, like he'll read a book like once a week. He always has a book, and he always gives me books to read. And I think just develop a good habit of reading is really something that will help. And also, I think this job too requires a lot of good communication and leadership. I think that's something that I wish that I developed when I was, a lot younger. Like because you have to lead the team. When you're in the hospital, you're leading the nurses and the therapists. So you really have to have good communication. That's something they don't teach you in school. So something you got to kind of pick up on your own.
Wow, that's awesome. Well, Kelvin, thanks for taking time. I know you're busy in your residency, but I do appreciate you taking time, and it's taken us a month or so, actually a couple of months probably.
Oh, yeah. Yeah, I was about to start my own podcast.
You should. We do need more native podcasters out there telling their stories.
Yeah, I've been asking you. You said you use the GarageBand app, right? So I've been trying to start mine, but it's not. So I want to like start. I've been trying to start it, but I've just been so busy. Yeah, one thing I love, like ever since I was high school, is I love like just listening to like heavy metal. So I really want to like talk to like heavy metal bands on the res, and just kind of I don't know, just because I think it's such a cool like underground like culture, that I'm sure. You said you're a high school principal, right?
Yes.
Yeah, so like I'm sure like kids want to learn about all the res bands, and I don't know. I just think it's something cool and unique among Navajos, and is that there's like I don't know, there's like this YouTube video, it's like this small like documentary on res metal bands.
Mm-hmm.
It's really cool. Yeah, I would recommend checking that out.
I'll take a look at it.
Yeah.
That's awesome. Yeah, if I would do it again, I honestly would just record them and then put it on YouTube because it's free. Mm-hmm. But if like with Podbean, I pay like I think almost $300 or $225 or something like that for a year for the membership.
Oh, okay.
So I think if I did it again, I would just put it on YouTube and stream it through YouTube because a lot of people are using YouTube. In fact, I've been trying to use my YouTube channel a little bit more, but I mean, Either way, it'll work. But I mean, you look at it though, I think the thing that's important is that there's content being put out there by Native people.
Yeah.
Because when I first started this podcast, I kept looking for Native podcasts, like to hear stories or hear about leadership or the perspective of Native people, and I couldn't find anything. And I feel with our elders passing away, we don't have those stories. Like, they're gone. Like, we always talk about Native culture being an oral culture, but if we can record these stories and sometimes my guests share personal stories about their family, then I have it documented, and I usually share it with families and the family that for the people that recorded. But I mean, that's where we need it. I mean, if we start seeing that, for example, like in the movie industry, we're starting to see actors, producers, and filmmakers out there, and we're starting to become more relevant nationally, in the media. And this is one platform that I think, but now they're starting to pop up, and I like listening to podcasts and hearing.
Oh yeah, me too. That's like, I probably listen to the podcast more than watching shows on TV.
Exactly, I do too. Either podcasts or audiobooks. If I'm driving or running, I'm listening to audiobooks or podcasts. So, but that's cool, man. Well, hey, continue working hard. I'm really impressed with what you're doing, and that's a story that our Native people need to hear, that that you're going through school, and I'm sure once you're done, people will want you to come and tell your story to audiences, because there aren't a lot of Navajo doctors. I mean, they're starting to be more, but I mean, man, it's pretty cool to see your business card and to see your name with an MD behind it. So. But I do appreciate you being on the show, and thanks for listening to the podcast.
Yeah, thank you. And then, so I'm starting my own I'm going to start my own podcast. It's called the Res Metal Podcast. So check it out.
All right, nice. I like that plug. Right. Good deal, man.
All right.
Hey, we'll talk to you later then.
All right.
Okay.
Yeah, thank you.
Hook on that. All right. Bye.
Bye.
Hello, listeners. I hope you enjoyed this episode, listening to the challenges and the tribulations of the guests that I had today. Please follow me on 21st Century Native Leaders. Go to my page, give my page a like for future episodes, and also for quotes from books that I read, articles that I read, and the pictures are from Indian country, but in particular the Navajo Nation. So I hope you enjoyed this. Hopefully you come back and hear another future episode. Have a good day. Yeah.